Hello, this is Dr. Stefan from interstitiallungdisease.info. In this episode, I'd like to discuss a little bit about what this educational project is, what my background is in interstitial lung diseases, and where do I plan to take this forward. And I'd also like to share why I like the field of interstitial lung diseases so much. And I think this is a good starting point because I have tried to put some episodes online. On the podcast, on the website, on the YouTube channel. And I think it lacks a little bit of context. So I'm going to aim to provide this in this video or audio if you are listening in audio only. So basically, my name is Stefan Christian Stanel. I work as an ILD consultant in Manchester, UK. I have learned about interstitial lung diseases working as a fellow here for about 3 years' time. And now I've started doing my own consultant clinics and slowly trying to do a little bit of research in this field. I am doing a doctorate in interstitial lung diseases here in Manchester at the University of Manchester. And I started this educational project because first of all, I do like to share information online. I've done it before, but it was more for patients. And I do have a YouTube channel in Romanian that's slowly becoming quite popular in my own country of Romania. And then I also start slowly to delve into the English language content to maybe reach a broader audience. And I think I like to discuss about interstitial lung diseases because I do like the topic very much. So the reason why is because when you work as a physician in interstitial lung diseases, you feel, a little bit like a detective. It's a bit of a mystery field. You have a lot of patients who turn up to their physician with cough, dyspnea. They don't know what's going on. You order some tests. You perhaps do an x-ray. It shows a little bit of a reticular pattern. You're not really sure what that means. You do a CT scan and it shows some kind of fibrosis, some kind of interstitial lung disease, some type of weird pattern of inflammation and fibrosis. And then the whole mystery starts because you're trying to determine what is causing that illness. And it's really strange because some of these patients perhaps have been having perfectly normal lives before they get diagnosed with an interstitial lung disease. And it's really important, I think, at that point, because this can happen to anyone really. And when you are a patient who is facing one of these conditions, I think it's really important to come across a physician who knows what they are doing, who knows how to at least order the right tests, integrate them into a diagnosis that makes sense, and really just to start off some sort of management for that case that actually makes sense. Because this is the biggest challenge in interstitial lung diseases, to do the right tests, to rule out potential reversible causes for the interstitial lung disease in question, because that would yield the best prognosis. So the more you know really about potential causes of interstitial lung diseases, the better you will fare when you're actually having to treat patients. So I find that challenge really exciting because I have the opportunity to really make a change, a difference for my patients. So for example, if you are trying to diagnose idiopathic pulmonary fibrosis, and I did touch upon in another episode on this channel basically about idiopathic pulmonary fibrosis and how to make the diagnosis. But if you are trying to make this diagnosis, you really need to be able to exclude other causes that produce a compatible pattern on a CT scan. So you do this either by ordering specific tests to rule out autoimmune conditions. You need to have some experience and expertise in diagnosing connective tissue diseases, even though you may be a pulmonologist. So you can't only rely on sending your patient to see a rheumatologist or some internal medicine specialist. You need to be able to understand the signs of rheumatological disease and how they affect patients with respiratory disease and how these integrate together. Then the other thing, you need to have a good solid grounding in occupational lung disease, because sometimes the lung fibrosis in question may be occupational in nature, or there may be an environmental trigger. You may be dealing with a case of hypersensitivity pneumonitis, and something in the patient's environment, in their home, at their workplace, something is triggering a very mysterious illness that progresses, the fibrosis gets worse. And if you do find that trigger, imagine you could change that person's life, because if they eliminate it, potentially their disease will stop. So I think that's something of a great responsibility that we as clinicians take on in this field, because we are trying to really diagnose mystery illnesses. We're trying to find a trigger, a cause for a condition that can be potentially lethal within the span of 3 to 5 years, if we are dealing with idiopathic pulmonary fibrosis. So I think it's really important to have the right information, the right tools to diagnose interstitial lung disease. And I hope with this educational project to develop this field a little bit more, to contribute something for free. In most cases, I think most of the content will be free on this channel. The podcast will be free, and I hope it will put you in the mindset of looking for interstitial lung diseases, looking for causes, always be on the lookout for certain autoimmune conditions, learning more about what this or that antibody does. And I will hopefully be adding more and more of this information to this channel. So you can follow this channel basically on the most commonly used podcast services. So I've tried to share it on most of them. And then obviously, if you want to see me perhaps recording these videos, or if you want to watch some of the videos, you can watch the YouTube channel as well. And there is also the website you can see here, right here, basically interstitiallungdisease.info. So hopefully this gives you a little bit of a background about why I started to develop this project, and I hope you'll keep watching for future videos, for future podcasts, and I'll try to build this content as much as I can within, sometimes limited time, but I feel it's a valuable project to take on, and hopefully you'll get some value if you are watching my content. Thank you very much for watching this, and I hope to see you in future videos, and we can maybe have a discussion through the podcasts. If you have any questions, or if you have any suggestions at all, please leave a comment in the comment section on the YouTube channel, and I'll try to cover as much as I can based on your suggestions as well, to make it relevant for you. So thank you very much, and all the best.